Sass Dr. Ben. Let's do one last one, and then I'm really gonna go to work. So this comes from, let's say, Breen. Yeah. Let's see. And good morning, by the way. So, are the CDC guidelines for leaving isolation after 10 days without a negative test for infected people safe? No, they are not. Or is it still a better idea to get a negative test before going back out or around family or back to work? Yes, it very much is. Um, the peak of the amount of virus inside of a person, the earliest that studies have looked at this are that this may be a day or two before peak symptoms. The latest, based on some people but not others, and some studies but not others, is that it's maybe a day or two after the peak of symptoms. But generally, yeah, or rather, not the peak of symptoms, but when symptoms first appear and are noticeable. Now, that's a really squishy term, symptoms, because you and I and everybody are dealing with several viruses right now because that's just part of the human condition. We live in a world that's full of them, and things like chickenpox and herpes simplex, from the one that gives you cold sores, these are always around inside your body to some extent. So are things like CMV and Epstein-Barr, if you've got those. And they're actually really common, like 20-30% of people, if I remember right. And so, yeah, we're always dealing with something. And that on top of allergies, dust, pollen, whatever the heck comes out of the paper mills around where we live in Texarkana, all of that stuff causes some, at least low grade, problems. And then trying to spot what is a first sign of maybe a coronavirus infection on top of all this and all the other diseases, infectious and otherwise. Yeah, and all the conditions that people have, that is very difficult. And so that's at least part of the variation in there. It's hard to know when to be sure, and different people are going to draw the line at different points. They'll say, the very first tickle in my throat, that's when I knew I had a sore throat. Other people are going to say, no. The point, it was building up for a while, but the point where I could no longer drink water without pain, that was the point that I'm going to report. Yeah. From a public health standpoint, it is always useful to have more tests. The only reasons that people are suggesting not to have tests are one is money. They cost the insurance companies a lot of money. But if it's not going through insurance, if it's going through I forget what the other thing is called, care or something like that, then those are costing somebody else a fair amount of money, whether it's I don't know if it's state, local, or national government. But yeah, trying to save money, and earlier on it was trying to conserve capacity. But we've got a situation in Texas anyway, a little different than other places, where we have something like 5 or 6% of the country's deaths, about 10% of the cases, and we're still hitting somewhere around 20% of people that are taking the test are positive, and that is not where you want to be. Even a negative test gives useful public health information, because this helps us narrow down the number of people and get a better estimate on exactly how many people have got it. So definitely, yeah, if you're symptomatic and there is a way, through the publicly funded thing, through insurance, through whatever, I would say, yeah, if you can wrangle it, you want to try and get that test. And if it's negative, it gives you the peace of mind to know that, yeah, it's probably all right. I can go back to work or whatever. The 10 days doesn't guarantee anything. And yeah, sending people back into a situation where they can then still potentially spread a virus further, that is not good public health policy. That's like maybe bare necessity, keeping, the economy open. But that is not the way that we get rid of this virus. That is making things worse, not better. Or rather, it's taking what I would consider to be unacceptable risks. Because, of course, it's not just one case. It's all the people that you potentially give that case to. And right now, the R value, R effective, is something like 1 for a lot of parts of the U.S., including Texas. And so you're going to give it to one other, but that person's also going to give it to one other and one other and one other and one other out of their 7 or so close contacts. And over again, you're going to see that, yeah, it's not just one, it's an entire chain that comes back to a particular case and a particular person that did something that they shouldn't have done or that they didn't know they shouldn't have done, basically. So, yeah. Um, I think that's completely a bad idea. They're trying to give some guidance for people in places where a test isn't possible. And it's not the worst guidance, it's just not sufficient. If you have access to a test, you should get a test. And we're getting to the point where I think most everybody would have some way to get a test, some kind of reasonably local option for getting that test done. And that's the way we get out of this. Just pretending and going back to the things we like to do, that's not the way. So there we go. Thanks very much. This is Ask Dr. Ben.